Hey everyone, in this video, we're going to be discussing the use of mechanical ventilation in the ICU. When someone is critically ill, their body may not be able to maintain proper breathing on its own. In these cases, doctors may use mechanical ventilation to help the patient breathe. Mechanical ventilation is a life-saving tool that can help patients with various conditions such as pneumonia, acute respiratory distress syndrome, and even COVID-19. It involves the use of a machine called a ventilator, which pumps air into the lungs through a tube that's placed into the patient's airway. One of the benefits of mechanical ventilation is that it can help to deliver high concentrations of oxygen to the lungs, which can be vital for patients who are struggling to breathe. Additionally, the machine can also help to remove carbon dioxide from the lungs, which can help to reduce the risk of complications such as respiratory acidosis. There are different types of mechanical ventilation, such as invasive and non-invasive. Invasive mechanical ventilation involves the insertion of a tube through the patient's mouth or nose, and into the airway. Non-invasive mechanical ventilation, however, uses a mask that fits over the patient's nose and mouth. It's important to note that mechanical ventilation can be uncomfortable for patients, especially if they are awake and aware of the tube in their airway. In these cases, the ICU team would use sedation to keep the patient comfortable and reduce anxiety. In conclusion, mechanical ventilation is a life-saving tool that can help critically ill patients breathe. It's used to deliver high concentrations of oxygen to the lungs, remove carbon dioxide, and reduce the risk of complications. There are different types of mechanical ventilation, such as invasive and non-invasive, and it's important to keep the patient comfortable with sedation. If you or someone you know is in the ICU, know that mechanical ventilation is one of the tools that the medical team may use to help the patient recover. Thanks for watching.